Hello, ladies. My name is Jamaica. I am a registered nurse, a wife, a health coach, and a mom just like you. And I'm coming today to sow some seeds as well as give you some nuggets to help you throughout your motherhood journey. These nuggets come from things I've seen while caring for women within the healthcare setting as a nurse, as well as from experiences. These nuggets will help you to realize as a Black mom that you've got this. So, welcome to Mahogany Mamas. And the topic of discussion for today is Black maternal health. This is important every day. The reason I wanted to discuss this today is just because I've recently seen in the headlines in the news, as well as two stories that have been circulating in social media about things that happen in two different states. One story, a young lady was in a hospital in Texas. She was pregnant in active labor, and you can see her sitting in a wheelchair, crying in pain. Someone's videoing the situation. You could tell she was in active labor. She's really hurting, and the nurse is ignoring her. She says she sat in the waiting area for 30 minutes, and 12 minutes after that, she delivered her baby. The hospital is investigating that incident. And then in a hospital in Indiana, a couple went to the hospital. The wife was in active labor and she was sent home. Someone is videotaping her as well, but she's on a stretcher. You could tell she was in active labor, trying to breathe through the contractions, tears rolling down her face, but she's being pushed out on the stretcher to the front of the hospital. And then you see her husband helping her get into their vehicle. They probably were en route to back to their home when she delivered on the highway. So then the husband had to turn around and take her and baby back to the hospital. They were going to get the care that they deserved and that they needed in the first place. So these incidents happen all the time and it's not right. First, I wanted to just give some information and then we'll go into some statistics. Black women in the United States disproportionately experience adverse pregnancy outcomes, including maternal mortality, in comparison to women of other racial or ethnic groups. Regardless of socioeconomic status, Black women are 3 to 4 times, I'll say that again, 3 to 4 times more likely to die from a pregnancy-related cause than white women. Research has shown that maternal mortality increased by 33% at the start of the pandemic, and late maternal deaths increased by 41%. A late maternal death is a death that occurred more than 42 days, but less than 1 year after a woman gave birth. However, the percentage of maternal deaths was even higher among Black and Hispanic women during the early part of the pandemic period. Okay, and now we'll look at some statistics. Maternal mortality rate. In 2019, the rate was 20.1. In 2020, the rate was 23.8 per 100,000 births, which represents about 861 maternal deaths. Black maternal mortality rates, on the other hand. For Black women, the rate is about 55.3 per 100,000 live births, representing an estimated 1,800 maternal deaths, the highest among any racial group, and this number has continued to increase over the last few years. 1 in 6 women experience mistreatment by healthcare providers during the process of giving birth. Rates of mistreatment for women of color are consistently higher, even when accounting for other maternal characteristics like socioeconomic status and partner race. 30% of Black women who delivered at hospitals in the United States reported they were treated poorly because of a difference of opinion with their caregivers about the right to care for themselves and their baby. I wanted to discuss Serena Williams. Everyone knows Serena. She is a retired tennis player, a wife, a mom of 2 girls, but she had a history of having a blood clot in 2010. And in 2017, after she had her first daughter, she had concerns about having another clot. So she asked about being started on a heparin drip, and that's a medication by IV to help with that clot issue, and she was brushed off. She started to have a cough and she ended up having to have more surgeries because of blood collecting in her abdomen. She had a clot in her artery and other clots. She said when she was in the hospital that her parents and her in-laws were in her hospital room and she didn't want to concern anybody. So she stepped outside the room and spoke with her nurse. And she asked the nurse, told the nurse that she needed a CAT scan of her lungs and a heparin drip. And the nurse told her that the medicine she was taking was making her crazy. She said she fought hard, and the nurse finally called the doctor, and she did get the CAT scan, and indeed, she had clots in her lungs. And I found this information in Elle magazine. It was an April 2022 edition. And she also stated, giving birth to my baby, it turned out, was a test for how loud and how often I would have to call out before I was finally heard. And I wanted to mention Tatiana Ali. She's another celebrity. Tatiana is an actress, a wife, a mom of 2 boys. She's an activist, a Black maternal advocate. She's a singer, and she owns Baby Yams. And they have some beautiful baby blankets, so y'all have to check her out. But I remember her as Ashley Banks in the sitcom The Fresh Prince of Bel-Air during the 1990s. But I remember hearing her talk about her birthing experience with her first son. She said that the doctor was being rough with her, that he slammed his forearm in the top of her belly and was doing a maneuver like he was squeezing toothpaste out of a tube. And she said after a while she was concerned about her baby's safety, so she asked for a C-section. So she ended up having a cesarean section, even though she had a low risk pregnancy. And she said that made her and her husband think differently when it came to having their second child. She had a Black midwife, and she opted for a VBAC, which is a vaginal birth after a cesarean in their home. 2 other celebrities that I wanted to mention that discuss their birthing experiences. Allison Felix, she is a former track star, and she owns a women's tennis shoe company. And Beyonce, the singer, they both had emergency C-sections, and they often discuss their birthing experiences. So that just shows that mistreatment can happen to anyone. I, as a nurse, had my own experience with being mistreated. I felt like I was not being heard. At 38 weeks, I had a fall, and when I finally was able to speak with the doctor, she told me just to take some Tylenol and I should be okay. But as I told her, this was my baby, my body, because when I fell, I landed in a plank. So I landed on my forearms, but my stomach was hurting on the right side. So I wasn't sure if I hit my stomach or if it was just from the stretching. And I still had my husband take me to the hospital. We were already en route when I was able to speak with her anyway. But the nurse even told me when I got there that it's better to be safe than sorry. It's good to get checked out, just because everything worked out and everybody checked out good, me and baby, thankfully. And then the next week I had another run-in with that same doctor, but when I called and told that I was having contractions, how far apart they were, she told me to drink 2 tall glasses of water and lay on my side to make them go away. But I told her I was 39 weeks, I am due, it ain't no stopping these contractions. And I knew they were different than the Braxton Hicks startup contractions. And that doctor didn't know that I was a nurse. I'm an OBGYN nurse. And so I know that when the nurses and labor and delivery nurses, as well as the doctors, tell you to drink 2 tall glasses of water, is because they think you're dehydrated. I know that when you're dehydrated, you can have some contractions, but that wasn't the case with me. And I always made sure that I drank plenty of water every day, especially while I was pregnant. And I still continue to do that, but she didn't want to listen. So those things happen. So I just wanted to mention that I had my own experience with that as well. And there are different types of mistreatment, and these are just a few. Verbal abuse, stigma, saying that a group of people, they may say like a certain group of people complain, or that these people come in a lot. Discrimination, saying they may feel like somebody doesn't deserve care because they poor, because of their race. Threatening to withhold a forced acceptance of treatment. As a patient, you have the right to accept or refuse care, delay or refusal of care. And I just want to give some tips on how to reduce Black maternal mortality. 1, speak up. Tell somebody. Don't just keep that to yourself. They need to know. Sometimes you may need to find another doctor or seek a second opinion. Have a support person with you during your visits at the doctor's office and during labor. Your spouse or significant other, a family member, a friend, even a doula. A doula is great support during labor, especially. Make sure that you're going to your appointments, ladies, prenatal and postpartum. I know sometimes women feel that they went to all their prenatal visits and they are fine, but sometimes you'll not know that there's a problem. For example, if you hadn't had high blood pressure, it may be starting to creep up after you have the baby. So you want to make sure that your blood pressure is okay, that everything is healing, and everything is returning to normal after delivery. Seek immediate care if experiencing an issue. Ask questions and make sure you understand what's going on and that you understand your options. All right, ladies, I just wanted to share those tips with you. I hope that some of those nuggets will help you throughout your motherhood journey, and especially if you're pregnant. So thank you for listening and joining me on Mahogany Mamas, and I hope you have a great day. Take care. Bye-bye.